Hi everyone, my name is Samara Alazar and I'm so excited to give my presentation today about genetic modification. Before getting into my presentation, I first want to thank the Global Health Leaders Conference for giving me the opportunity to speak on a project that I'm very passionate about, which is the most threatening scientific advancement, genetic manipulation. Here's a quick overview about my presentation. I'll first be discussing a little bit about me, then I'll be introducing my topic and a couple of key terms and key points. Then I will dive deeper into these said key points. And lastly, I will end on my call to action and my references. So first, here's a little bit about me. I'm a rising junior who currently lives in Springfield, Virginia. My extracurriculars are listed, and I serve as working a youth board officer as the events chair. I'm a DECA competitor who placed third at states and advanced internationals. I'm an NHG competitor who placed second at states and also advanced nationals. I'm a tutor for arbitrary youth tutoring, and I'm active in clubs including ESA, Girl Up, MUN, and UNICEF. And this isn't listed on the slide, but some things I like to do in my free time is hanging out with friends, playing tennis, writing, reading, and watching new shows and movies. Now I will briefly introduce my topic and how it relates to global health. So you may be asking, what is genetic manipulation of an embryo? Well, genetic modification of an embryo is currently defined as a scientific practice that allows medical practitioners to genetically alter a human embryo in vitro. This practice originally gained traction in the late 20th century. However, the debate regarding the ethics of genetic modification was re-sparked in 2016 after He Jiankui used this method on two unborn twins. In regards to global health, the legalization of genetic manipulation would cause further economic and medical inequities because solely wealthy people will have access to erase certain genetic mutations in their embryos. Also, if genetic manipulation evolves to the point where scientists can manipulate embryos to acquire greater levels of intelligence or athleticism, only the wealthy will have access to these said benefits. Before getting to the specifics of the harms of genetic manipulation, I'll first go over a few important key terms. First, I will discuss what Pgd is, which stands for pre-implantation genetic diagnosis. So Pgd allows for embryos to be tested for genetic diseases caused by mutations to prevent these mutated embryos from fertilizing. These diseases include sickle cell anemia, cystic fibrosis, and Hurler syndrome. This practice is legalized in the US and is not regulated by federal law. Currently, 75% of fertility clinics offer Pgd to patients. Now I'll be going over what PGM is. PGM stands for pre-implantation embryo genetic modification, and it is a scientific practice that allows for genetic manipulation to be completed on a human embryo. This practice is currently illegal in the US. Now I'll be discussing the key points of my presentation. So the overall thesis of my presentation is that genetic manipulation, also known as PGM, of an embryo should not be legalized as it puts the life of the baby at risk, further perpetuates the misconception that all disabled people have a negative relationship with their disability, and causes greater economic/medical inequities globally. The first point I will dive deeper into is the fact that the legalization of PGM can put the life of the baby at risk. This is due to the relative newness of this procedure and the fact that this very advanced method hasn't been tested enough to be safely performed on human embryos without causing harmful mutations. In fact, CRISPR-Cas9, the most popular scientific technique that can permanently genetically alter human embryos, is known to lead to the growth of tumors in the genome of genetically manipulated babies. This can obviously lead to cancer and will overall be detrimental to the health of these babies. Now I'll explain the specifics of how genetic manipulation further perpetuates the harmful misconceptions about the disabled community. Many PGM advocates believe that the benefit of PGM is that it can eradicate specific disabilities. However, this causes further stigma around disabilities because these advocates are treating it as a defect. Another issue with this is that PGM advocates exclude disabled people from the conversation regarding how PGM should be used towards disabilities, further pushing the ideology that people without disabilities know what's best for disabled people. I would like to highlight a quote on this slide, which reads, "The concern here is that people with disabilities would be less valued at a societal level as genetic technologies become more common, especially in the absence of public education and media campaigns on disability and genetics. This shows how PGM will inevitably lead to disabled people being even more ostracized in society because the medical community continues to try and find ways to erase a major part of their identity rather than teaching inclusivity towards people in this community." Lastly, I would like to talk about how genetic manipulation of an embryo will cause further economic and medical inequities. This is due to the fact that any potential benefits that would arise from PGM would only be accessible to the wealthy due to the inevitable expense of this procedure. Although the healthcare system already heavily favors the wealthy, this practice will continue to increase the economic divide between the rich and the poor. This shows how PGM will unavoidably create what is known as genetic caste, which refers to wealthier classes being able to acquire genetically advantageous traits as opposed to lower classes. The final thing I would like to discuss in this presentation is what needs to be done regarding this dangerous practice. First, I call upon the medical community as a whole to stop perpetuating the idea that the potential effects and damages caused by PGM are all known, when in fact there's no way to currently understand the long-term effects of PGM. This means that the medical community can't actually promise the informed consent that they are pushing to the public, and this untrue promise is very dangerous and unethical. Individuals themselves need to, one, educate themselves on the harms of PGM by reading unbiased sources, and two, they need to vote for politicians who vow to keep PGM illegal, as legislation is the only true way to protect the public from the danger of PGM. These are the sources that I used for my presentation to find all of my information. Thank you so much for listening. Please do not hesitate to contact me regarding any further questions. And I again want to thank the Global Health Leaders Conference for this amazing opportunity. My email is listed on the screen at samara.alazar@gmail.com. Thank you again.